I'd like to get that. Welcome everyone to our Quality Cafe. Today is our 9th session of our Quality Cafe. So just a quick overview. Our Quality Cafe includes a 20 to 30-minute learning session followed by question and answer, and it's open to anyone interested in the topic. And our goal is to foster networking and shared learning among our quality professionals here in Alaska. And we're currently doing this every 2 months, which seems to be working. Like I said, this is our 9th session. These are all our previous 8 sessions. If you're interested in any one of these, we're happy to send you the recordings. Just reach out to Debbie and or myself and we can get that to you. Right, and with that, I'm going to turn the screen and everything over to Ann Pierce. Ann is the Process Improvement Quality Coordinator at Central Peninsula Hospital. We're super excited to hear what she has to tell us today. So I'm going to stop sharing. I can find my button here and let Ann take over.
All right, wonderful. Thank you so much, Kristen. It's a joy to be here today. My name is Ann, and I am relatively new to Central Peninsula Hospital. I started with them in August in the role of Process Improvement Quality Coordinator. I am a lifelong Alaskan, though. I've been here forever, and I've most recently have been in HR and the university setting. So I'm going to show you some of the stuff we're going to talk about is actually in my previous role, but we're going to talk a lot about process mapping today and how that can help with what we're working on at our various hospitals. So I'm going to go ahead and get started. As we go through this, there will be questions, but I will pause throughout to make sure that we have an opportunity to answer everyone's questions that they have today. And then we'll actually be doing a demo as well of how to do a process mapping session. So first of all, what is process mapping? That's a kind of a key word that you hear thrown around a lot, but what does it really mean? Really, process mapping at its most basic level, it's outlining what steps need to be taken in order for a process to work and coordinate appropriately. So we can do this here at the hospital, everything from patient admissions to getting specimens to lab. Process mapping can really help us take a look at what's being done and what we should be doing. There's lots of options with this. I'm going to show you some technical resources, but by no means think that process mapping is limited based upon the tools that you have. I have sat in process mapping sessions where we have sat with a pile of sticky notes and written things down and put them up on a whiteboard. So you can really go low tech all the way to some of the higher process mapping solutions that are out there today. So we're going to show you flowcharts, but be aware that there's other options out there as well. Flowcharts do tend to be the most popular. We'll show you an example here in just a minute. But we also do, as you get further along, there's swim lane diagrams and value stream maps as well that you might find useful. So why are process maps important? And I think one of the things that we've found over and over again with process mapping is that processes can become really convoluted. Especially if you have a lot of different people working on the processes or different people trying to create the same goal, but maybe they're taking different paths to get there. So things tend to become really convoluted and tangled up. Process mapping allows us to take a break from what it is that we're doing on our day-to-day basis, sit down in a room, and just start to untangle the mess. So at one level, it's just a simple tool for training. It gives you an actual process that's visualized, makes it really easy to hand off to a traveler or to a new person who's joining your team. Because how many of you have travelers and how many of them actually read all of your processes and procedures? You can give them a one-sheet decoder ring. It kind of helps to streamline that communication tactic. It also makes sure that there's common understanding. A lot of times when you sit down and you start talking through what a process looks like, everybody's going to have a different opinion or a different thought on how things have been working. And so really coming down together and saying, when you touch this piece of the puzzle, that causes this reaction over here on this side. And so being able to have that common understanding and that common perspective is what is being done and what needs to be done. Process maps are super beneficial in that regard. One of the other things that we've seen just here a lot recently is that it also clears up communication. So it allows us to find those variances, to identify areas where there might be waste, and then start to decide how can we align our processes a little bit better so we're providing better services in a more timely manner. Once, basically, every time you put one of these down on paper, you're going to start to find those areas where there's miscommunication, where there's places that need improvement. So it's just a really great tool. We've had a lot of success with it so far. So let me show you an example of a flowchart. This is your most basic flowchart here. This is not one that we actually use at the hospital, so I threw one together just to give you a quick demo. But in a flowchart, we'll have a beginning point of what the process is, and then we go through it step by step by step. We can have situations in here where we have a decision point. So once we've requested a bed for a patient coming in through the emergency room, is there a bed available? And then depending on what that response is to that decision making or that decision point within the process, that lets us know which path we need to take. And then we get to the end of it. Now, like I said, this is a really simple version. These are great to be working with either in a process mapping software, using Visio, you can even use PowerPoint, or even going back to basics and just using those sticky notes on a whiteboard. Now, sometimes it's helpful to get a little bit more creative with your process mapping. So this is what we call a swim lane diagram. I don't know how many of you have seen these ones before, but they're fantastic for really identifying different roles of responsibility. So if you have a document or a process that's being passed back and forth between different areas within your hospital, it's nice to be able to color code them and really distinguish who is responsible for what steps and what steps do those impact. So here, just briefly, we put the physician in the emergency room, house supervisor, and then the floor care team to let you know who's the one who's going to be doing the actual admission to the hospital. Well, that's our doctor. But who's going to be assigning the patient to the floor? And that's our house supervisor. And so really allowing us to delineate who is responsible for what can clear up some of that miscommunication. So swim lane diagrams are kind of one of my little fun ones to have, especially when you have multiple teams or multiple people involved. When you're doing a process mapping, you can go out there and Google process mapping. You will find a ton of different symbols that are available. You will find a lot of different ideas on how to get them, get those process maps done correctly. I'm going to say though, at the most basic, you really need to just have three main types of shapes that you're using in your process maps. We've got a terminator, that's your beginning and your end point. The processes themselves, which is done usually by a rectangle or square, and then the decision point, which is our diamond. Those are your three most popular. And if those are the only shapes that you ever use with process mapping, you're going to be absolutely successful and you're going to have a lot of good returns. For me personally, I like to add on a couple of different flavors. One of them that I like to use is delay, because in my world, waiting for something is wasteful, right? So where can we find those areas where we are waiting for someone to approve something, or we're waiting for something to be processed, or we're waiting for someone to show up? If we can identify those areas, then that gives us an opportunity to eliminate that waste, or at least cut down on it and save save money and save time for our patients. Another one that I have started using a lot recently, particularly here with some of the process mapping we're doing, is the yield sign. So it's a shape and a color that we are all associate with in our driving world, and it makes us pay attention and pay caution. So this also here in the process mapping section, I like to use it as a place where maybe there might be a pitfall, or there's something where we need to proceed a little bit more carefully and pay attention to other aspects. As you go through and you're doing process mapping, what shapes you use and what symbols really don't matter. What matters is that for your organization, you have a common language and a common understanding of what shapes you're going to be using. These three, as I mentioned, are pretty industry standard, but there's nothing to say that in your organization, you don't have another shape that you identify that's going to be used for a common procedure that's used, or something, maybe it's a particular group that you're working with that you want to make sure are identified since they're more integral to what your process mapping. It doesn't matter what you do. There's no hard and fast rules. What I will say though is as you're going through this, if you ever move past just these basic points or you start color coding, please make sure to put a legend on your process mapping. That can really help clarify that communication and make sure that if you're not in the room when somebody's reading that process map, they know exactly what shapes mean what items on that flow chart and what colors might signify. Also with colors, I just want to throw a shout out. If you are color coding within your process mapping, just be cognizant of the fact that if you have folks in your organization who are colorblind or have sensitivities to color, they may not be able to see those. So when you're doing a process map, our goal is to make it accessible for all. So that's one of our caution areas and our words of warning is just to be aware of that as you're building your own. Okay, so now where do you get started? Well, once you know what process you want to map out and you have an idea of what kind of tools you have available to you, whether that's sticky notes or Visio, then you need to start getting your team together. So the meetings that you're going to set for process mapping, what I have found to be beneficial is to have 4 to 5 people at most in the room. You don't want to have 20 people or you just won't get anything accomplished. And you want to make sure you have a good group of people who understand what's being done currently, what are roadblocks and situations that might be faced by the front line. So it's really important to have a frontline staff member there if you're trying to actually get the realistic process map done. And then you need to have someone who understands the compliance and what needs to happen. Once you have those folks in place, you're ready to set your meeting. And my recommendation from my experience has been an hour is usually what you're going to want to start with, especially when you're mapping processes where you're transitioning a patient from one location to another, or specimens are going down to the lab. Those things get pretty complicated pretty quickly. We found that an hour time frame seems to be the most beneficial and allows us to get a lot of work done that first session. Some process maps you'll have done in an hour and you'll be finished and on your way and walk out the door. Other process maps after that first hour, you might have to go back and revisit. One of the things about humans, we think we remember exactly what steps we take when we do something, but it's not until we actually talk about it, articulate it, and then go back and do it again that we realize that maybe we've missed something that we had spoken about earlier. So be prepared to come back to your process map and review it and revise it. When you're meeting with your team for the process mapping, some things that are pretty helpful is just to make no assumptions. Don't assume that you know what's happening because somebody's told you or you've seen it, or maybe it was even something that you used to do 5, 10 years ago. Make no assumptions. Let the team who's actually doing the work be the ones to talk to you through what it is that they're doing for the process mapping session. And ask tons of questions. For those of you who've done a lot of process improvements, you all heard about the 5 whys. When I'm doing process mapping sessions with our teams, I'm asking why a lot. And that helps us know if there's decision making, are there quantifiers that we need to include in it? So ask a lot of questions. Process mapping sessions, also, sometimes you might have to come back and do them multiple times. I think the biggest process map that I've done so far took 3 days of face-to-face meeting, and it had over 100 items on the process mapping diagram. So we had 100 shapes on that board. It was pretty huge, pretty robust, but we were able to map out a really complicated process and see all the downstream effects of what was happening within that department. So it was very, very helpful. Okay, so next we are going to actually jump into a demonstration with a product that we're using here at the hospital. But before we jump into the demo, I wanted to see if we had any questions.
I'm not seeing any questions in the chat.
Okay. All right, well, we will have an opportunity here after we do this demo. But during the demo that we're going to do, I'm going to need some audience participation. So we are going to actually go through and do a process mapping session where I'm going to be your coach and you're going to be the ones who tell me what to do. So let me bring up what we are working on here. So Here at the hospital, we're using a product called Lucid, Lucid Chart. This is what we have chosen to go with. There are, like as I mentioned, there's just a ton of options out there. You can do process mapping in PowerPoint. You can use Visio. You really can use anything. So this is not a marketing ploy. I'm not affiliated with Lucid. I just want to put that out there. This is just the tool that we have chosen to use here. So I would like to process map out making coffee. This is something that most of us are all familiar with, and many of us do on a daily or multiple times a day basis. So here's what I need from you. We're going to actually map out this process. So I need to have you guys tell me, what do you do for making a cup of coffee? So what are some steps? And we don't have to be linear at this point. At this point, we're kind of in a brainstorming session, and we're just going to throw out some ideas.
This is Dina. I grind my beans.
Okay. So I'm just going to throw out a shape here. And as you see, as we go through this, I'm going to ignore all of those rules that I just told you earlier about shapes and what shapes to use for what part of the process.
Okay.
During the brainstorming session, I like to just throw stuff up here on the board, and then we can see where it goes.
All right.
In grinding
What
those
else?
beans, do you get them out of the freezer, the refrigerator, or the cupboard?
Well,
Okay.
mine are stored in the grinder for a bit because I have a larger one. So I guess that's different for everyone.
I have in the chat, get a mug or a cup.
Okay. Perfect.
You would also probably need your filter. And to put your water in, depending on now, because you've got pour over, brew.
Okay.
French press.
What type of coffee? There's a bunch of things in the chat. I'll read them out as you're typing. Get filtered water.
I drive through the coffee drive-through
Fancy.
and get my cup of coffee.
This is my source of caffeine. I don't drink coffee, but I love this one. Wash out the coffee pot and throw away the old filter.
Okay.
Start the campfire. Love it.
So, okay. So remember what I
are we
said
doing
earlier where I said this was a simple process, right? And we can already see that with this simple process of just making a pot of coffee, we've thrown in a ton of variances and a ton of decision points along the way. So we're going to isolate down some of the stuff and simplify a little bit. But I think that's a really great demonstration of just how things that we think are simple can be a little bit more complicated than we thought. And I'm going to honor the drive-through because I am also with you. Okay, so our process here, these are different options, and we are going to focus on just the drip coffee for simplification for what we're doing. So we need to identify where the beans are at. I think we said, somebody said filtered water, right? And I'm not sure exactly what we're going to call it, but is it the carafe or the hop burp or where the water goes?
Reservoir. That's what I call it.
Reservoir, thank you.
But again, I don't drink coffee. Someone put in the chat, grind the beans, fine.
Grind the beans.
I call it the same thing, Kristen.
I'm glad we're using consistent language.
And that's an important part as well. When we've sat in a lot of these meetings, I would say that one of the things that's been really helpful for me is that I don't have a background in healthcare. So I have to ask a lot of questions and ask people to define different words. We've actually taken now to putting a definition box in our flowcharts. So what that would look like is something to this effect. Just so that we all have a common understanding of what it is that we're talking about. Because really, at the end of the day, what we're trying to do is make this clearer for everyone, right? Rather than adding to complexity and confusion, we're trying to take away from that complexity and confusion. Okay, so now we've got some shapes out here. This doesn't look anything like a process map yet, but we're gonna get there. So we know we want to start a cup of coffee. So we're gonna say that we have a need. So we need coffee. So then our next point is really what type of coffee is it that we're going to make? Because you guys gave us a lot of really great ideas out here. We had a pour over, but that's going to be a different process that we won't actually define today. So you see, I just changed that shape to a box that's got lines on the side of it. That is, that meaning of that shape is pretty much that there's another process. So rather than writing out how you would make a pour over coffee or a French press coffee, we would just say, hey, this is just letting people know that this is another process that's out there. You could link to that process map if you had it somewhere else. But for right now, that's as far as we need to go with that. And then I'm going to give these all as options. Oops. All right, well, I'll get that yes and no out of there later. And we're going to focus on our drip coffee. Okay, so with the drip coffee, we need to grind the beans.
You
But
need
in
to know
order
how
to
many
do,
cups of coffee you're going to make, because that will
how many?
determine how much you grind and water and everything.
Okay, that's a good one. And this is why I don't usually put the arrows in until the very end. So we're going to make drip coffee, but we need to know. Oops, and I got to get them out of my. Okay, so once we've decided how many cups, what's the next step in our process at that point? Would we retrieve the beans, get the water?
Not sure if it matters which one you do first.
Okay,
I don't
we'll
think it
have,
matters either or.
Measure and grind the beans and get the beans in the chat.
okay. And then prepare the filter. And then should we get the water? Fill the reservoir?
Yes. Although, did we decide not to wash out the coffee pot? We decided we didn't need that step.
Well, that's a good question. Do we need to have that step?
I don't,
Laura
because
says
I do
yes.
it. I do it when I'm done the same day, but some people might.
So maybe we just need to ensure that the coffee pot is clean and in place.
Yeah, good point.
Okay. I see we've missed a step though, because we fill the reservoir and then the last thing we have is get a mug.
Right.
What did we miss?
Well, you have to turn on the pot or get the brew going. I would also say, depending on the type of drip pot you have, you can choose classic, rich, etc. It can get very complicated.
You can. That's incredibly correct.
And then for those of us that don't drink it black, after the mug, we'd have to add our cream or whatever else people add to their coffee. Have to doctor it up.
Okay. So a couple of things that we didn't put in here was we had said where are the beans and the freezer cupboard were some items that we had noted that we just wrapped that up into retrieve and grind the beans. But if we don't know where the beans are at, maybe that's something that you could add in here. As I mentioned, I like to put sometimes the little shapes in here. I use this as a caution. And maybe we say beans may be located in the freezer. And we can adjust that based upon the unique situations of our brewing location. Now, one of the things that someone asked on here or said I heard in the conversation was it doesn't matter which prop step we do first. And that's a great thing to ask a question on, right? Does it matter in the brewing of the coffee? Now, for a generic coffee pot that you get from Walmart or Target, probably not. You can probably do it in whatever order you want. But you also might have a pot that has a very specific order that it requires the water to be put in first, or it requires the beans to be ground first. One of the projects that I actually worked on years ago when I was doing my Six Sigma training is we looked at coffee brewing in particular, not with a drip coffee, but at an espresso stand, and mapped out where everything was in that espresso stand and what order they were making the coffee in, to determine if there were ways that we could streamline the number of steps. So were they stepping over to the ice machine and then stepping over to the cut machine and then stepping back to the ice machine? Was there a way that we could eliminate waste by changing the order up in how they accessed materials or did their job or performed special duties to reduce that waste? And so I think that's something with these process maps, you know, maybe it doesn't matter what order those steps go in, but maybe that order could have a really big impact depending on your equipment or your environment. So hopefully that was a little bit of fun for you guys to step away from the day-to-day and move into thinking about a nice warm cup of coffee. We'll jump back into our day-to-day world. And let me just tell you about some like successes that we've had, some real world things that have gone on where process mapping has made a huge difference. Recently, we worked on, this is before I left the university, we were working on pay increases for employees and how that process was. So we sat down and process mapped it. It took us 2 days, 2 meeting times for an hour each to map that one out. We had 48 steps in that process. There are 8 decision points. So 8 different people had to touch that process at some point to make a decision, to make an approval, or to make a decision. We had 5 approvals. So if we needed 5 signatures for each one of these changes, we sat down in a group, were able to take that process map and just start asking, does this add value? Does it add value to check the coffee pot to see if it's clean and ready to go? I would argue yes, but there may be situations where it doesn't add value to the situation, to that process. So asking, what is the value add for each of those steps? We were able to narrow that down. We got it to 11 steps, 2 decision points, and 2 approvals. So we took something from a process that took like a week of actual work time with a lot of waits and delays and got it down to something that could be done in 1 to 2 business days. Here recently, we were working on a nurse-driven protocol in regards to catheters. And this was a process that had been worked on for a couple of months. And we had a policy that had been written and reviewed and written and reviewed. And then we sat down and we started process mapping it and realized that we had some decision points that we hadn't addressed in the policy. So there were some areas where maybe our wording wasn't as clear, or it was confusing when you're trying to read through it and figure out what the next steps were that you should take. So by process mapping it, we were able to see where the decision points needed to be, what rationale should go into those decision points, and then actually just revise the policy minimally. Really, we didn't make a lot of huge changes, but it was enough to be able to clarify that. Also, recently, we've been doing a lot of work, as I'm sure you guys have as well, streamlining our policies and our procedures in regards to behavioral health, suicide intervention, particularly within the emergency department, but not isolated there. Those were work that we've been working on with our behavioral health group, our emergency team, our inpatient teams. And we had gotten to a point where we kind of just got to a stopping point because Team A is saying one thing, Team B is saying another thing, Department C is saying something else. And we all thought we were on the same page until we process mapped it. And then as we process mapped it and started asking questions, we designated levels of level 1, 2, and 3. But none of us had the same definition for what those levels were. And only by sitting down and actually process mapping and asking the questions, how do we distinguish? How are we delineating? How do we know where people fit? Were we able to really understand that we were speaking with the same language of English and the same words, but we were talking two totally separate scenarios. And so really in those situations, sitting down, it's been a game changer for us to be able to really come up with that clarification, come up with that common vernacular, and come up with a visual image that's easy to follow. We can hand it off to our travelers. We can hand it off to our newbies. We can use it for those situations where maybe we don't do that process on a daily basis, so we don't remember it from 6 months to 6 months. It gives us a one-sheet guide that we can look at. And so it's been really helpful for us. So, and that those successes that we've shared with you, I hope that shows and it really empowers you to be able to take an opportunity to go back to your own teams, look at the processes that you have, and try to start to identify where you could benefit from sitting down and drawing it out on a piece of paper to see what that process looks like when you put it down in a way that people can see it differently than we can in a policy or procedure. So that brings us to the end of the actual presentation, but I'm hopeful we have lots of questions that we can have some good discussions. So go ahead and shout them on out.
So would you say, this is Meredith and I work at South Peninsula, would you recommend like maybe a class or something to really get a firm foundation in process mapping? Are there some places to get some CEUs or?
So there's a lot of really good references out there, Meredith. And then we have a handout that's going to be coming out, a PDF, and I put some links at the bottom of it of some places to go. AHHA has some introduction to process mapping that you can find on YouTube. There's a couple of other like Lean Six Sigma groups that have some process mapping out there. You can find lots of free stuff, but you're really not going to learn it until you do it.
Okay.
And the great thing is you really can't mess it up. Like that's the most beautiful thing about it. It's not rocket science what you're doing. So it's sitting down in a room. And that's why like I like starting with whiteboard and sticky notes. As cheesy as that sounds, it lets you move those items around a lot. And that's what I like about, like Lucid or PowerPoint. Put down your thoughts and then just start moving things around. And you saw like with the coffee exercise, right? We had some things that we threw out there that didn't end up adding value or didn't end up needing to be in there. You also might identify other areas that you need to fix. So,
yeah.
Or other thoughts. So there's some training out there. Hands-on experience though is really the best way to get you where you want to be.
Okay, thank you.
Mm-hmm. And Kristen just put the handouts in the chat, so hopefully you guys can download those.
Do you recommend putting the process map in your policy and procedure, or does it live somewhere else?
We currently are not placing in the policy or procedure. So I think that's something that you'll have to determine what's the right fit for your organization. We're not doing that at this time, but that's really up to you guys.
Well, this has been wonderful. Anyone have any other questions? Feel free to pop them in the chat. We have one here in the chat. Is there a rule of thumb to help determine the level of granularity needed for each step?
So Patricia, that's a great question. And that's a one that it really depends. So when I'm looking at policies, you know, sometimes if our procedures that we're working on, if we have a step that's instantaneous, right? Like maybe in a computer, we have to hit this button, then that button, then this button, then that button. I don't know that I would level out or would spell out each particular step, but I would, you know, summarize it at the front. If you do have, and this is going to happen where you have a process that comes through and one of your processes maybe we're going to do XYZ and then we need to send the blood specimen to the lab. Rather than spelling out all the steps of what it takes to get that specimen to the lab, you can throw a box in there, and you saw the ones that I used that had the 2 lines on the side to link to an actual process for that. So you can just say, we know that this item here has 20 or 30 steps, but rather than spelling out all of those steps on this process map, we're just going to identify it in a way that folks know there's a whole separate process map for that we have over in another location. And the other thing I would do is, you know, if you go too granular, you can always pull back out, right? So there have been a lot of times we've dug down too deep in the weeds. And so going in there and saying, okay, is this helpful? Does this add value? Sometimes just taking a step back, taking a break, taking a breather, getting a cup of coffee, and looking at the process map maybe a day or 2 later, you might come back and see yourself and go, you know what, we went too deep on that one, or we need more detail in this area.
Not seeing any other questions. So let's have you Anna Han, great job. We enjoyed having your presentation today. Just wanted to remind everyone our next Quality Cafe will be in March. We haven't picked a topic yet. So if you have something you'd like to share or something you'd like to learn about, please let us know. And then there's just a quick survey when you leave the Zoom meeting to help us keep these Quality Cafes valuable to everyone. So thank you everyone for your time and have a great rest of your week.
Thank you, Kristen.
Thanks a lot, Anne.